I really believe that the IV has such a big effect on musculature too. Like my first IV was a 300 million IV like 8 years ago. And I think I put on like 10 pounds of muscle that year, barely trying. Because I mean, you think you break muscle, you build it back, like it makes perfect sense. And that's what we found with the back treatments. That's the only orthopedic treatment we do that we add in IV is our
Mm.
back because it seems to help the back muscles stabilize everything too. We see better outcomes.
All right, everyone. Welcome back to another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. Stefano Sinicropi, and today we're going to go down one of my absolute favorite topics. It is a rabbit hole that, people always talk about rabbit holes, sometimes in a negative connotation. Stem cells are a place that we need to be going. It's the future of medicine. I ask my colleagues all the time, what's next? All about stem cells. I'm giving a keynote here next week at the Society for Brain Mapping, and I'm talking about, one of the pillars of spine care is really going to be stem cell, treatment. So it is my pleasure today to welcome Joshua Ketner, who is the founder, along with his wife, of the Dream Body Clinic, which is located down in one of my favorite countries, Mexico. We're there every year for our for the holidays. We go to Cabo, not where you guys
Nice.
are located, but it's really a pleasure to see a clinic, the Dream Body Clinic, which is helping so many people to get their lives back where they really don't have other good solutions or solutions that are working for them. So yeah, welcome to the program today. Let's I really want to dive into what you guys are doing, how you've been so successful, and why this is really truly the future of medicine.
No, thank you so much. So yeah, we're down here in Puerto Vallarta and we've been doing the clinic for 13 years, stem cells for the past 8, and just been helping a lot of people with things they should be able to do up there. I mean, that's my real honest view. And there's a lot of little things holding it back that are unfortunate.
So, I always, when I have my guests on, just to kind of to set the stage, and I think you're the perfect person to ask this. And I've asked this maybe like 80% of the time when people come on. You are, a West Coast guy. You live most of your life up in the Seattle area after your youth in California. But what's going on in the American medical system. I mean, we spend $4.4 trillion on care. It's mostly sick care. The preventative aspect of what we're doing, the root cause medicine, is so far down on the list of what we are focusing on. Let me ask you a question. And you could go on a rant, whatever you want to say, but what's the biggest problem with what consumers are faced with in American medicine today?
Oh, geez. I mean, that's a big question. But I'd say the information. I mean, the whole term stem cells, let's start there, right? It's such a catch-all general term that is just ridiculous. I mean, we use mesenchymal stem cells, and we worked with Dr. Arnold Kaplan, the man who named them in the past, and he wished he could have renamed them medicinal signaling cells because they're not even really a stem cell in your body. And so now you hear stem cell, you just think these cells are going to turn it into whatever tissue you need. And what we do doesn't even do that. And that's the confusion right there, I guess, is the first start is they've got to be able to understand this. And why would someone care? I mean, you really just care. I mean, the first question I ask people, I'm like, what hurts? Like they always say, and like sales that find the pain point. I'm sure you do too. You're like, what hurts? Like,
Yeah,
so yeah,
the
that's
basics.
what we do. We're trying to fix the pain. So I think it's that, and then understanding the legalities. The more I've dug into that, the just more ridiculous I've found that it is. You can't patent a mesenchymal stem cell. So, I guess the short version is who's going to spend hundreds of millions or $1 billion in like 10 years to bring a product to market that you can't patent, you'll never get your money back. So it's this giant moat in the whole medical system that prevents so many amazing treatments, including stem cells. It just shouldn't be there. So that's usually where I start.
No, absolutely. I think that's a good answer. I think some of the things that I really kind of to dive in is it's a two for me it's a twofold factor. From a I'm a physician, I'm an MD, right? DOs train a little bit different, but in general, our medical schools here that are producing the people that are giving information to others don't teach any of these things. I mean, for God's sake, we have like a day of nutrition, and health. That's it. And most people can't even remember learning anything that has to do with preventative just not. Yeah, I mean, yeah, cardiac prevention stuff, just the usual stuff, but not like true overall health. So that's one pillar of it. And a lot of my book is really preaching to the docs and saying, guys, come on, open your mind, stop being in the silo. But the other thing that I think that industry has been able to do here in the US is to really brainwash the minds of the American consumers in that they need their drugs and they need their procedures in order to have any benefit whatsoever. And so when people hear, hey, we're using light therapy to help people with their concussion, or we're using laser therapy, or we're taking your own body's mesenchymal stem cells, putting it back into you and it can heal you, they're like, oh, I don't believe that. That's not possible. But I always tell people, if I say I can literally make up the name of a drug, I can say, we have, what? Great news. I have a friend and he came up with XOB 743, drug. It has 19 side effects. You might or might not, you may or may not, like go blind, but it's just a low chance, all this stuff. And they'd be like, doctor, thank you. So where do I get that? And how much
Sign me up.
Was my insurance, I'll figure out a way to do it. But I tell them, hey, we want to put you through this concussion program that has nothing to do with, there's no medicines involved. There's no anything. We have all this stuff. And they're like, what's that going to do? It's not going to do anything. You got a pill, for me. So the hacking of the American mind is this subject that we talk about constantly. I mean, industry, including our own, including the medical industry, the food industry, pharma, everybody has done a great job of telling people they need this crazy high level care with all this stuff. And that, would you agree? That's just not, it's not true. In fact, some of it is really harmful for them because we don't have a chronic disease we're winning on. We're losing the battle across the board.
Yeah, I went to a conference many years ago and the guy was a neurospecialist and he looks around and he goes, how many people here are on a statin? All these hands go up. And he goes, how many of you have read the side effects? And all the hands go down. And he starts reading them and he goes, what diseases are those? Just dead silence. He goes, it's Parkinson's and Alzheimer's. He's like, what do you 100%. Think your brain runs? You've got 35% cholesterol to run your brain, and we're giving it something to block that. Like, I mean, what do you think's going to happen? So it's, yeah, you're a pill for a pill for a pill. Unfortunately, I don't like that.
Yeah, and it's interesting because I had a specialist on, this guy, just world-class guy, and he just ripped statins to shreds. But he was talking about how you can, like, for example, to improve your lipid profile, like really the advanced lipid profiles, the apoproteins, how effective niacin is. Niacin is like, I don't know what it's like, 4 cents a pill. It's like nothing. It's a vitamin, right? It's a vitamin. But yet the pushback in the medical, right away, you say things like that and people are like, oh my God, this guy, you were talking about vitamins now. We're not, so it is interesting in our society how there's more pushback against crazy medications with crazy side effects, all kinds of procedures that are done on people all the time. Like when you look at pain management, I mean, we are overdoing it beyond, it's just insane. That's why I'm so involved in trying to help people's pain without all this other stuff. That stuff, that's great. That's fine. No one's really, I mean, people are maybe like, some people are upset, whatever, but you say like the other stuff, biohacking, stem cells. Oh my God, that's why. And I ask people, why would there be so much pushback on things that are so incredibly safe? The safety profiles of like what we're going to talk about today, compared to some medications that people are on that are going to be watching this podcast, it's ridiculous. The gap between them is like oceans. apart, but yet look at what is scrutinized by our institutions and what is sneaking through the cracks because of the tight bonds, right, between industry and all of our organizations here in the US.
For sure.
And the thing is, I have no problem calling it out because all people have to do if they want to know is Google it or go on, if you guys got sucked into the whole DeepMind thing, go on DeepMind. It'll tell you, China will be happy to tell you,
Yeah.
how much we're kind of getting, bamboozled. So anyway, we can go into a huge, deep rabbit hole in that because obviously I'm passionate about it, but people they're being hurt. And the biggest thing I feel like is being hurt, which is why this is going to be a great show, is because they are being almost blocked intentionally from getting the information that can make radical differences in their lives. And again, just for my audience, this isn't medical advice. Everything you hear, this is for educational purposes only. But we're going to get into stem cells, what these guys are treating down, in Mexico, and what they are really finding. So now we'll go backwards a little bit. Now we talked a little bit about before we started the show, what really spurred you to just say, you know what, this is a necessary, this is something that's just needed. We want to give access to people to have these technologies. I can't do it in the US. So, how did this all come about?
Yeah. So I guess they always ask that question, like,
Yeah,
what radicalized you?
exactly.
Like,
I get it.
and I mean, because people, they're going to hear what we're saying sometimes and they think it's kind of crazy or, hey, you're out there. But it makes perfect sense to me. I think we're the sane ones in those thoughts. But my dad got sick. It was about 20 years ago. He got Lou Gehrig's disease. He's got this big aerospace company. I mean, he's literally a rocket scientist and they have nothing for it. So, I mean, a guy like that's going to try his own way, right? So he starts doing his own research. This is 20 years ago. The internet wasn't as good as it is now. But what he came up with, well, it's a muscle wasting disease. How do we treat other muscle wasting diseases? And he goes, well, if you got HIV muscle wasting, guess what? They're going to throw growth hormone and testosterone at you like you're a bodybuilder. So he asks, can you give me that? And they look at him like he's crazy. And they go, no, that falls under the Anabolic Steroid Act. And he's like, I'm 50 and dying. I'm not going to go play pro ball. Like, who cares, I mean, but they didn't care. I think they gave him like 1 IU every other day of growth, which is nothing, and like 1 cc a week of cypionate, and that's nothing if you're trying to fight muscle wasting. I don't think it would have cured him. I don't think it would have saved him, but he didn't even get the chance to try, and they just make you this guinea pig in these trials where you don't even know if you're getting the experimental drug or not. I mean, it's pretty crazy the way they have it all set up, especially with something terminal like that. Well, he passed. I was helping to caregive, and I noticed I liked taking care of people. And his business he gave to the employees because they were there. I'm 22 at the time. It just, I didn't know what I wanted to do. And should have stayed with them because they sold that for a lot of money. But I got into caregiving, and I started working for a Place for Mom. They're the largest senior healthcare placement service in the United States. And I help people all over the West Coast find a place for mom. And it was great. And I read an article one day and it goes, man outsources parents to India. It kind of made me laugh. And I'm like, genius, I go, great doctors, low cost of care, not overregulated. That's what drives the costs up. Because it's what I noticed. These assisted livings are amazing, but like, if somebody trips and falls, they get like a red flag, and they've got this whole online database that they just find the hell out of these companies. It's insane for a lot of stuff they didn't even do. So it's just such a tough like business, and the costs are so high. And we used to vacation in Mazatlan, Mexico every year. And I was like, well, Mexico's pretty similar because no one's going to go visit mom in India. It's too far, but they might go to Mexico. So I had a friend down here in Puerto Vallarta that was doing real estate. My job was work from home. I moved down. I'm, checking it out and found, yeah, it really is possible. It's a good idea. Had some pretty big investment groups interested. It just never quite worked out. And then I met my wife, and her sister's a doctor, and realized I could get growth hormone, I could get testosterone, other medications that were tough. And it's legal to seek medical treatment abroad and return home with medicine. So I started a program for that, and we've been doing that for 13 years, helping people with human growth hormone. And they're finally getting some of the studies out. There's like the new TRIM study, TRIIM. It shows, they're finding guys, it's reversing age on epigenetics, methylation, DNA methylation tests. It's regenerating the thymus, little
Mm-hmm.
gland you got here. It produces your T regulatory cells. So they're finally doing some research. Well, I've got some very top level military doctors that are patients of ours, and they've admitted the military has so many studies on growth hormone. It's a big reason they suppress it because they give it to all the top end soldiers, and they don't want to get that information out there. So it's been a big part of why it's not used for more things. So we started there. So we're already we're working in longevity. And then we started hearing rumors, because you hear rumors in Mexico, oh, there are cancer cures or this and that. And you hear stuff, and I don't believe anything till I've experienced or know it and really check it out. So we ended up digging into the stem cells, and we met a guy who did his PhD in cellular biology like 18 years ago. Really smart guy, and started working with him. But then we quickly realized the quality control just isn't quite there in Mexico. So I realize we're working with Americans. We don't just have to be at American standards. We have to be above it, because people have a bad perception of Mexico. I know I did before I moved here. So we knew we had to be above and beyond, and we started working with like the University of Guadalajara and some these top biologists, and we got our own thing going, and that's what we've been doing ever since. And helping a lot of people with mesenchymal stem cell treatments on top of some of the different flying by stuff, but it's now mostly stem cells, helping out joints, autoimmune diseases, chronic degenerative issues, and it's been really good.
Yeah, I mean, I think that's great. One of my interests now for when you say quality control, just so that our audience understands, you're talking about, so in the United States, utilizing stem cells that are not your own, coming from outside. In other words, products being from another donor and then getting into your own body. There's more regulation than it's insane, and that's something that's just not done. So for example, our clinic where we do regenerative medicine, that's not even a thing that's offered to people. I mean, there's some people that are trying to do it, but so can you explain the difference between using the patient's own cells, and when you're talking about quality control, you're talking about these products that then can be delivered to people, just so that we're on the same page?
Okay, so in the US, you've got three options. You can do the bone marrow aspirate, you can do a liposuction. They're probably the least efficient, because less than about 1% of the cells you're getting are actually MSCs. It's like PRP. You're centrifuging it, you're separating that, but you're still getting stem cells, which is awesome. I mean, if that's all you can get or have access to, it's amazing. The next step is you can do umbilical cord stem cells in the US. A lot of people don't think that's possible, but it is. But it's very difficult. There's only a few labs, and they have to use a whole umbilical cord and placenta. You're chopping it up, you're putting it in a centrifuge with collagenase, you're spinning it, you're separating. It's about 70% MSCs, 30% other types of cells, but that's as far as you can go. The US, two laws in the US that really hold it back are homologous use, meaning like for like. And the scary part is they could interpret that however they want. That's why it's a dangerous one, right? And then you've got minimal manipulation, which is what defines if it's a medication or a treatment. So by just centrifuging it, that's considered minimal manipulation, because you're just taking something from the patient, putting it back in. I mean, just like PRP, that should be legal, and it is. So that's good. We take it a step further in that we do that process, but then we centrifuge that last bit of cells down to what we call the pellet. So we've got this little pellet, looks like a little white chunk, and that is then put into flasks with culturing medium. And at that point, we put it in the incubators so we can control the CO2 levels, the oxygen, and all this. And there's details there where the quality control comes in, because if you take these cells and put them in human tissue, well, they're going to an environment that's going to be about 11, 13% oxygen. Well, most cultures are about 22%. So you want to have it lower, because you're creating a more similar environment to inside the human body. It's a bit more stress on the cells, but that's good because they're kind of pre-stressed. Not everybody does that. So, I mean, these are minute things, but this is where the quality control comes in. And then you've got to do your culture. You can't, every time the cells eat through the culturing medium, that's like their food. That's called a passage. And now we've got to take it out, and we're going to put more culturing medium in. But first, we have to do an enzyme flush, and that gets rid of all the extra cells. because the mesenchymal stem cells adhere to the plastic flask. So we flush it out, and we don't get to pure isolated mesenchymal stem cells till about the third passage. So by passage three, now they're replicating this whole time. We're getting a lot more cells. And then we'll go to maybe the fourth or the fifth. Well, I mean, they've done studies where they found if you get up, once you get to about the 10th passage or higher, the cells will keep replicating, but they start devolving. They're
Mm.
not evolving to something better. They devolve actually, and you end up with cells that are too large or misshapen because they'll replicate pretty much forever if you really wanted to. But now the two problems are you end up with really large amount. So if you go further than like five passages, like you're going to have too many cells for your patients. Like we treat 120, 150 patients a month, and we need one umbilical cord every 2 to 3 months. If you're doing further passages, you might not need as many umbilical
Oh,
cords, but now you're going to have to cryogenically freeze those cells, which that's kind of the problem in the US too. When they do the umbilical cord in the US, they make them cryogenically freeze them, and they're selling them to doctors that don't either have the right equipment to thaw it or just thawing it in their hand. And that's going to, it's like throwing a Coca-Cola in the freezer, it'll expand. Well, if you put it out on the counter, it's probably going to explode. If you put it in an ice bath at the right temperature grades, it actually won't. So you prevent a lot of die off there. That's why we don't work with frozen cells. We just prefer not to.
yep.
Every researcher in the world does. It's totally, this is a big misconception too, the freezing. It's totally fine to use frozen cells. We just don't because of how we do it. We stagger the cultures. So we've got fresh batches every day. But in the US, they have to do that. And then you've got to make sure your lab quality control. I mean, like the filtration, air filtration system I have in my lab is like, I brought it from Tulsa. I mean, it cost a fortune, and we had to get ISO rated, and ISO does all the international standards, and most places don't do this. There's a lot of little clinics and labs around Mexico that are just using an incubator with a hood, and the hood is ISO 5, which is amazing, but if the outside environment isn't ISO rated, you get a lot of particles, you start risking
Mm.
contamination. So it's a big part of it's really on the contamination side. And probably one of the best examples of this was a company called Livion that got real famous in the US. They were doing the amniotic fluid stuff in San Diego. And it literally was what you would think of like a Tijuana lab. Like it was this doctor from Tijuana came up. They got all these big name investors, and they hurt a lot of people. There's a really good podcast by Wonderly called Bad Batch that goes into the details.
Mm.
But the lawyer, the lawyer that represented all the patients and won every case actually ended up being our patient. And it's the best testimonial I have because he starts it out and he's like, "Hey, I'm Brian. I sue stem cell companies, and Dream Body Clinic fixed my bronchitis." And I'm like, "That's awesome." So, so quality control matters. The process matters. There's a lot to it, I guess. It's kind of a long answer. Sorry.
No, I think that, I mean, that's a great explanation because, it's exciting to see. And I think things are definitely, again, we're completely apolitical on the show, but I think with some of the changes and kind of who's running the health departments now, I think there's going to be some change in the thing. We're not going to ever have the ability anytime soon to do what you guys are doing, which is unfortunate, but we still can progress, because I tell you, like, even with the BMAC, which is obviously an advantage over just their usual PRP, or the alpha 2 stuff, the A2M, it's making a huge, and again, it also depends on the pathology that they had. So, for example, like for degenerative joint disease of the knees, we're seeing it's amazing, the pain, because it's thought that a lot of that pain, right, comes from the osseous innervation. And so if you get those stem cells in where those defects are, right underneath the cartilage, people are having just 4 or 5 weeks later, they're like a different person.
Okay.
But it's exciting, to see what you guys are doing, because again, we're focusing primarily on musculoskeletal and a lot of spine stuff like intradiscal work and around the facets and things like that. But we are certainly, and this is where I want to really get into it with you, we're not in any way, because it's really no touch up here, even though people are desperate for this stuff. I know people, because now that they know that I'm involved in somewhere where we're doing musculoskeletal stem cells, they say, well, my kid has this, or oh yeah, my grandpa has this COPD. Could stem cells? And I just say we don't. That's a no touch. For us up here in the U.S., there are clinics that are doing it like in their basement. What goes on in the U.S.,
Yeah.
but obviously we're above board. We're all board certified, and we have to do what we can do within our scope. Tell me about how exciting we have a huge chronic disease problem, both in the U.S. and
Yeah,
in Mexico, and I'm sure a lot of maybe
for
more
sure.
clients are U.S. But tell us, why are stem cells effective in like a chronic disease? So, for example, like an autoimmune disease, like MS. You guys treat a lot of MS. You treat these things. Why is that? Why should the audience like believe that maybe that is something that they can look into? Where I will tell you, the US doctors here, if a patient goes in and says, hey, I have this disease, I'm going to go get my stem cells in Bolivia or Panama, let's say Panama, where they're doing a lot of stuff,
Yeah.
right away doctors are like, oh my God, I can't believe you would even say that. Those people should be and obviously we both know that's I have all kinds of stem cells. I mean, my
Yeah,
desk
yeah.
is filled with stem cell therapy books. Can't do half of it because I can't offer it to you. We can't offer it to people. So
Uh,
tell me, how does it work? Why should people believe what's the science you don't have to, we don't have that. I mean, this isn't like
yeah, no.
it's not a seminar, but what's the science behind it, and why should they believe? And then we'll get into some kind of what patients are experiencing. And I want you to talk about some of these really high
Sure.
profile patients without names, of course, but just let us know
Yeah.
what you guys are doing.
Yeah, well, let's just start with the basics. Like my job is I get to talk to some of the smartest people out there, and my job's to dumb it down because I fear if I can understand it, then most everyone else can. So the easy way to look at it, like a mesenchymal stem cells, think of it like the manager on the construction site. It's not a stem cell in the sense you're thinking. It's technically a pericyte. They live on the capillary. So imagine my arm's a capillary. It's a pericyte. They live on the outside, like a little octopus squeeze and wrapping around, and they squeeze, release, help blood pressure. But if you're injured, they come off, they go to that area, and they're like the manager on the construction site. So they're not going to build the house, but they're going to tell everyone how to do it. And they do this by sending out, well, they used to call them extracellular vesicles, and now they're calling them exosomes, which I'm sure a lot of people have heard of. And the stem cell is the smart part. The exosome by itself, it's good, but not as effective because the stem cell will send the correct exosomes to the right place. And there's over 1,000 different types of
Mm-hmm.
exosomes. We haven't even named them all yet. I mean, they're so tiny and small,
Yep.
so it's difficult. But they deliver these different things like a cytokine. And you hear some bad things about cytokines during COVID, cytokine storms. But if you have an autoimmune disease, by sending specialized cytokines to like a B cell or a T cell, it's like hitting the factory reset button on your computer. It's getting it, if the software is not running right or has a virus, it's going to get it back to default mode. And that is why we like to take these from umbilical cord tissue, because like we worked with Dr. Kaplan in the past, and at a conference I was at, he goes, look, if I've got type 2 diabetes, I don't want my own stem cells because mine are compromised. They're not working right.
Mm-hmm.
And he points at this other doctor who's much younger, and he's like, I want his. And he goes, the cool
Yes.
part, I can take his. He goes, we could do a muscle biopsy. Any tissue with capillaries has MSCs. He goes, we could isolate those, culture them, take them, inject them in me, no problem. And there's no risk of rejection because they lack what's called HLA, human leukocyte antigen. I mean, they have it, but they don't represent it. They're considered immune privileged, and that your immune system doesn't react. They think they're your own. So, as far as your body thinks, you're getting more of what you used to have because up
Yes.
until about age 18 for women, 21 for men, well, you hit bone maturity, you lose 90% of your capillaries because you're not growing taller. You don't need all that extra blood flow, but that means you lose 90% of your mesenchymal stem cells and you don't heal as well. So we're just giving your body back the ability to heal the way it was when you were a little kid. So the Mexican government approved stem cells because metformin was bankrupting the socialized healthcare system. There's such a huge problem with type 2 diabetes. For a while, they were given metformin for free and they had to stop because it's one of the cheapest medications in the world and they couldn't afford it anymore. It was going to bankrupt the whole system. They heard that mesenchymal stem cells could help and they were like, yeah, approved, start doing it. And that's a big part of why we're able to do it.
I think that's really exciting. So just tell me from, again, just for our audience, and I tend to attract a pretty skeptical group. Like they want to learn, but they don't quite know. But they're come. Our audience is coming around. We'll just say that. So when it comes to, like, for example, for degenerative disease, if somebody is riddled with osteoarthritis throughout their body, and right, as an orthopedic surgeon, I all day, every day, right, this is all we see of these people, and losing mobility is a huge thing that ages us and helps. Our both our health span and our lifespan can be affected by losing our mobility. Do you treat them systemically and locally in a case like that? So for example, like we're treating like these really bad varus knee deformity where people really don't want surgery, even though they'll do fine with a knee replacement, but they're just like, I want to push it off for 10 years, whatever. So they'll have their stem cells.
Yeah.
You guys, do you do it like systemically and we'll treat if they have a really bad knee, or will you just treat them systemically and see how it goes, or the other way around?
Yeah, I mean, like knees are top treatment. Everybody's knees go, as you know, and then lower backs are probably number two, and then it's different IV treatments after that.
Okay.
I was patient number one. I mean, I don't offer anything I haven't done myself, and I had multiple meniscus tears, partially torn ACL. And I didn't even know, like, I just knew my knees always hurt. Did the MRI and saw how bad it was and did treatment. And, 3 months later, it stopped hurting and did that follow-up MRI at 9 months. And yeah, full regeneration. And I just did a new MRI like last year. And yeah, it's held up. I had some first degree patella arthritis from riding my bike too much, but my ACL and meniscus have held up ever since because it really guided the repair of that tissue. So yeah, we treat a lot of people. We see a lot of rheumatoid arthritis. That's where we go both ways. Like the IV is going to go through the bloodstream. So an IV is not going to help your knee. It's not going to help your joints, right? Because very little blood flow to cartilage, ligaments, tendons. So you have to go direct. It's pointless to go systemic.
Yeah, and that was just Mike. I was just wondering if there's a general anti-inflammatory benefit from giving the systemic treatments in addition to to targeting. So what did you specifically get on your knees? Because I tell you, just like so the audience know, just to let the cat out of the bag, I'm actually going to have BMAC on my left knee by Dr. Sager, my partner, and we're going to do it. We're going to do a whole YouTube thing on it and just and whatever, and just get before and afters and do all
Great.
that for social. Because I agree 100%. You should have the treatments, like all the biohacking stuff. I've done all of it. I post about it. I show people like me in the bed and doing my oxygen and all that stuff. So what did you actually have done? Did you have the cord cells put in, or what'd you have done?
Yeah. Yeah, I did the cord cells. Back then, we were doing a little lower dose. We did 44 million. We pretty much found we can fit about 25 million MSCs per milliliter of sodium lactate. So for joints, we want to do a more concentrated dose. We found if we start going higher than that, you end up with two problems. The cells start to die off quicker. Usually, I mean, they'll stay viable in sodium lactate refrigerated for up to about 72 hours. After that, you start seeing major die off. So we always administer within 24 hours just to not worry about that. But the other problem is that we found if too high of doses and your knee will lock up and it hurts. It happened to me like the second time I did my knee, it was like last year, and it's not fun. It doesn't swell up or anything. It's just a weird response. And this happens sometimes even with BMAC. Like I had a patient yesterday that did BMAC in his shoulder last year, and same thing. It locked up. It got very painful. And we've actually found that's usually when you're getting like higher doses or there's different phenotype markers, your body can react a little different. It's rare to have that kind of pain, but it does happen. And yeah, I did 44. We do 50 million in knees now. we've played around with lower doses. We used to put PRP in with the stem cells originally, and we stopped doing that. We were working with Dr. Correa. He used to be the assistant professor of sports med at University of Miami. He's kind of like Dr. Kaplan's right-hand man. He kind of replaced Dr. Riordan in Panama because he went and did his thing. So Correa kind
Okay.
of became
Yep.
his right hand. And he was advising us, and he's like, stop with the PRP because it's great for like shoulders, backs. We add PRP to the stem cells, but for knees, it's a hollow chamber. You only have so much volume you can put in there. And we found if we put too much fluid, you'd have, not a huge amount, but maybe like 5-10% of people, their knee would swell up. And we're like, what's the point, right? The stem cells are going to work with or without that PRP. So we stopped using it there. And we're always adjusting things, but we've pretty well figured out where our doses are, and our goal is to put as many cells in an area as we can without any risk of side effects or
Right.
problems like that. And that's what we've done.
Yeah, I mean, obviously, if you over, I mean, that's what people have to, understand. Like the good clinics really are always working on their protocols and titrating it. Because even like with some of our biohacking stuff, like we have patients that have all kinds of autoimmune disease, but you have to be careful because even like with some of the light therapies, if you give them too much light, then they'll detox. So they might feel great for a day, like a Lyme's patient, and then for 72 hours, they're in bed. And we found that early on in the experience. And so it's just getting that right protocol and the sequencing and when you do, like different treatments. And it's no different with stem cells because everything is overdone. It's like when you take a drug, there's a reason that not everybody needs the same. Well, most people don't need a lot of the drugs they're on. Let me say that first of all, they just don't. I had a patient yesterday. Yeah. I go off on these things. I'm not even. I had a patient yesterday that was like he was on a medicine for gout. The guy never had gout, and he was insisting it was for his depression. I was like, I listen, my friend, this is for gout. Just letting you know, let's look. So we looked it up and he's like, oh, that's interesting. I never had. So people don't even know what they're on. So we got to be really judicious. Just letting you know, let's look. So we looked it up and he's like, oh, that's interesting. I never had. So people don't even know what they're on. So we got to be really judicious about fixing this stuff. All right, let's get back to before I go on let's not go there. Let's go back to degenerative things. I love the fact that number 2 is the spine because a lot of like my patients now are coming in and they are asking questions, but they're actually pretty shocked because I was like, oh, I didn't even know that you could do stem cell treatments for the spine, maybe because it got a little bit of a bad name like a decade ago where especially in our town where people were just claiming and you're right, the word stem cell, some of the ways that people were using that word was clearly false, misleading kind of stuff. But when you guys are targeting the spine, are you targeting the entire, like the whole motion segment? So let's just say that somebody comes in and they've got like a small spondylolisthesis, which is a slip of one bone on the other with a bad disc at L4-5, one of the most common things that you see. Are you guys going disc, facet joint, and after some, like maybe the inflammation around the nerve, or is there what's kind of the specific protocol that you guys are doing?
So again, we've tried everything. We used to work, like a good friend of mine's an orthopedic. He worked with the Miami Dolphins in the past. He worked with the Barcelona soccer team. So he's a really good orthopedic surgeon, and his best friend is an ortho spine specialist. So we spent like a year and a half. Our original protocol, and the one we still do now that we find works best, is we don't go into the disc. We actually found, I had a herniated disc at L4, L5 4 years ago, really bad sciatica. I mean, it felt like a cattle rod to my femur. So we do an MRI first, like we've got our own open MRI on site, and we saw that it wasn't too bad, but the nerve pain was just off the charts. So we line it up with L4, L5, and we do 4 shots around it, intramuscular, like one of the most non-invasive, easiest treatments you could do. And then we also add an IV of 100 million. And the reason we do that is because when we first got going, we had 4 patients, all in their like mid to early 30s, just bros. They wanted to get back to the gym. They all had sciatica. They
Of
they
course.
didn't listen to the, take your time after rehab advice. And they all went back to the gym too soon. And nerve pain heals fast. Like my sciatica was gone within 10 days. And I did everything wrong. I flew to Peru the day after treatment. I'm climbing Machu Picchu, carrying it was like the toughest back workout of my life. Stupid, shouldn't have done it, but I already had the trip planned and it healed. These guys had similar experience. Their sciatica was gone quick, and all 4 got back to the gym too quick, doing deadlifts and dumb stuff they shouldn't have. And the 2 that did the IV, because we used to give the option to add the IV or not, the 2 that did the IV never hurt themselves again, healed up perfect. The 2 that didn't ended up hurting themselves again. And
Mm.
I really believe that the IV has such a big effect on musculature too. Like my first IV was a 300 million IV like 8 years ago. And I think I put on like 10 pounds of muscle that year, barely trying. Because I mean, you think you break muscle, you build it back, like it makes perfect sense. And that's what we found with the back treatments. That's the only orthopedic treatment we do that we add in IV is our
Mm.
back, because it seems to help the back muscles stabilize everything too. We see better outcomes. So then years ago, we started going intradiscal and to the facets. We do a twilight sedation in the OR, fentanyl, and it's not fun. You still feel it to a point. And we never saw better results doing that. We always hoped that that would like fix
Mm.
stenosis or rebuild discs. And it never really did when we compared MRIs. Now, with stenosis, we've never seen the discs like grow back. With herniated discs, we have, because you still have the whole disc, it's just misshapen.
Right.
We're rehydrating the disc, right? So it's rehydrating and kind of getting back to its normal size and shape. So we did it for like a year and a half, and it more than doubled the cost, very invasive. And like you said, patients all the time don't even know what meds they're on. We had one guy that was on like a ton of like Ambien and other things and doesn't tell us. And, we're doing this fentanyl drip, and he ended up okay, but yeah, we were pretty freaked out there for a minute. This guy's like looks like he's sweating to death on the table, and
These people, yeah.
it all ended up, yeah, I mean, you have to be honest with your doctor, but you know how people are, they don't even think about it sometimes. So we decided the risk to reward there wasn't for us. Now, it doesn't mean it doesn't work. It doesn't mean it's not a good idea. There's still other clinics that do it. I think there's one in Tijuana that still goes into the disc. There's one in Colombia that does. But for us, we've just found such good success with that like we just said, hey, look, if you've got that worse stenosis, you're probably going to want to go to another clinic, more of a specialist, and you got to find what you're best at. So that's what we found. We're like, you know what, this fits us better, and that's what we do.
No, I think that's great. That's good information. I'm fortunate, we don't have that. I could tell you that, and one of the some of the stuff that we found is that you definitely get some improvements in the disc with the BMAC in the disc. In fact, one of my partners who he does spine surgery, he actually, after he does the discectomy, he takes the patient's bone marrow cells and injects them into the disc. And he's had great, and in his thing, it's about preventing recurrences. I think that around the nerves, like I was telling you before, my Dr. Sager is he's been grandfathered into this amniotic fluid. This company that was very much on the up and up was not like that, that other group, but has like amazing stuff. Because I'll tell you, I know a lot of my friends have actually had it done for theirs and have had really good results. But one of my partners, Dr. Butterman, who's an orthopedic spine surgeon, very well known guy, hugely published. He's in our group, but he's worked with Dr. Sager in the past, and they actually have the data, interestingly enough, that shows if you use the amniotic fluid around herniated discs, they clearly show significant benefit and shrinkage of the disc, even when they're the ones that are still contained with the parent disc. It's really interesting because you're just getting this bomb of anti-inflammatory stuff, and the body can kind of heal itself. So I think that the jury's out, and you're absolutely right. Like everybody's kind of got to do what's best in their wheelhouse. We're just lucky we have Dr. Sager, who is a master technician. That guy can put a
Yeah,
needle and get it within like, a millimeter of where he's. It's pretty. I mean, teaches all
that's a
over.
skill
He
people
teaches
don't
all over.
realize.
No, they no. Well, you know what he does a lot? Like we'll sit down, I'll sit down with Dr. Sager, and he likes to pull up x-rays, fluoroscopy of other people who have attempted injections and show me how not even close to what they were trying to inject that they were. And I'm like, I get it. You're very good. I get it. I get it. But after a while, you're like, I get it. I get it. I get it.
Yeah.
I get it. You're great. That's great. They're trying. But anyway, so I think it's true, and it is, and it's just very, very interesting. But I think that this concept, just as a spine surgeon, this is what I get most excited about treating the entire motion set. You guys are doing that broadly, right? Because you're treating around the muscle and then you're giving the IV. So you're kind of getting everything. But with
Well, we're
us,
using a much higher dose too. You
right.
got to think. I mean, that's our advantage is we're using like hundreds of 100 million in the back. So we're not after precision. We're
Yeah.
just general area, and it might take a little longer, but it's going to get where it needs to go. So
No,
yeah.
I think that's absolutely right. We have to do like very precise, targeting. Like we're actually bringing in this CT scanner. It's the highest resolution CT scanner in the world.
Oh,
and
cool.
and that's it's the cool thing. I'm actually on their scientific advisory board. When I just fell in love with this thing, and now I'm working with it. But you can see, if you have in this CT scan, just to give it, you can see a tumor the size of a grain of sand.
Whoa.
That's how crazy it is. When they showed me those pictures, I got invited to this meeting one time and I hijacked the whole thing, as I often, you could tell by my podcasting. I'm kind of a hijacker of stuff. But anyway, I hijacked this thing, and the thing we're excited about is that if you overlay a PET scan on top of that, then for example, and again, you guys are doing it different. We have to be like super precise targeting. If you have like a whiplash injury, we can, between the PET scan and this high resolution CT, we can say, you know what? It's the inferior part of the C5, C6 facet joint that is causing all of your right-sided pain. And then and then all the stem cells go right in that one spot, because we can't deliver what you guys can deliver, in Mexico. You just deliver what
Yeah.
you deliver. And that is a highly, that is, a highly effective way of getting it. But no, but I'm real excited. I mean, all I'm thinking about what we're doing this is like, I'd like to experience some of this stuff myself. So you might be seeing me down there. Listen, I know that you have a ton of physicians, celebrities, the who's who in America comes down there to get their treatments. Obviously, from my perspective, we'd love for them, for the stuff that they don't need all the high level stuff, come and get our stuff. But certainly, it's awesome. Let me ask you a question before we get into, because I want to hear some stories. People just love stories about people.
Sure.
Do you guys do any? So one of the things that we've been doing in our clinics, we do a pre-treatment protocol. So for example, if you're going to have your shoulder done, we'll do shockwave therapy on them for about a week, because that
Nice.
helps to release stem cells and do stuff. So we use something called the Piezo Wave 2, which has the FDA clearance and all that stuff. It's also great for pain management. So it's also good for shoulder strain. People
Yeah.
do amazing. Do you do any pre-treatments on your patients before you do like the musculoskeletal stuff? Because we found that it really get a better result if you get some of this if you pre-treatment, and then we post-treat them with a class 4 laser, which can also help the stem cells work better.
Yeah, no, we actually don't. That's why we're going with the higher doses.
Mm.
And you got to think like almost all our patients are from abroad, US,
Good
Canada,
point.
Australia. So they can't be here for 2 weeks. So like I'm always recommending things. So I mean, I'm glad you said that. And I think anyone out there, that's something you should look into doing before, just like post treatment. Like there's one clinic in Colombia that's like, they do their videos and they show them go into the hyperbaric chamber and it looks cool. But when you read this stuff, I love hyperbaric chamber. I had one for a while, but like one session isn't going to fix anything.
Correct.
You have to hit about 40 sessions to hit a real therapeutic dose. So it's an amazing, there's so many good things you can do after, but I think you need to find things you can do locally if you want to do that. And like, supplements too. We found undenatured type 2 collagen.
Yep.
And this is just from it is the best results I've seen. I mean, I keep track. Who are the outliers? Who went from second degree arthritis to 100%, or who went like we had one lady third degree, both knees, 100% with one treatment. And I asked her, I'm like, any supplements? Undenatured type 2 collagen, consistently what I see. So there's things you can do completely. People ask about peptides all the time, and probably just like you, like I love biohacking, I love all that stuff, right? Like I'm like, yeah, play with some TB 500, play with some like BPC 157. Like I've been on growth hormone for 12 years, I love it, like I'll never get off this stuff. But like but yeah, there's other thing. I just say, look, the stem cells are the manager, the peptides are like the workers, the
Right.
supplements, these different things, that's like the bricks to build the house. So if you got more of all of them, you're going to build the house faster. You're going to heal faster. It's just what happens.
And I mean, you're right on it. And it's so interesting that none of this was in my wheelhouse, nothing a couple of years ago. Again, it was all diet and exercise and an obsession with this stuff.
Yeah.
And then when I learned the science, because in many ways we're almost like, as physicians, we're almost blocked from getting this information. So, for example, like biohacking, I get called on 10 times a week by somebody who's trying to sell me some product. In my entire career, no one's ever tried to sell me anything to do with light therapy, photobiomodulation, and some of that stuff is over the top expensive.
Amazing.
No, and it's amazing. Well, the results are never tried. No one's ever tried to sell me a class 4 laser in my entire life. Never got an email. I never got a memo. I never got anything. No one said, "Hey, doctor, maybe you should add peptides because these small molecules can make this huge difference." There's never been a person to come to me with the stem cell stuff. Well, in the U.S., it's obvious. It's because the reason that they're not doing it is because the middlemen don't really exist because they're so regulated. And so
Yeah.
because we don't have middlemen, even for the people's own body stem cells, if other people can't make money, of course they're not going to call on me to try to sell me this stuff. So yeah, it's exciting. I'm glad you're into all the other stuff because I think that yes, absolutely, stem cells are a huge part of it, and I've become like a massive believer. But all these other things can make a giant impact. Like even treating people after their stem cell treatments with laser therapy on that area, it's pretty dramatic because it increases blood flow, lymphatic flow, it energizes the mitochondria, it does all this stuff. So these combinations, so you do the pre-treatment, the post-treatment, you do the targeted stem cell protocol. I'm hoping in the future we can do what you guys are doing. Otherwise, I'm going to have to go start a clinic or join your clinic in Mexico. I don't want to say that. No, I won't be over there. I'll be on we'll do it in Cabo. That's where we vacation.
Wait
But
till you come here, man. This place is way better than Cabo.
is it?
Cabo's just South LA, man. You got to come down to the jungle.
Hey man, listen. You know what? I have teenage kids. I have stuff. We're just like not partiers. We just want it. Like Cabo's kind of quiet for
Oh,
us, like where we are.
so's Vallarta.
Is it?
Vallarta's all the retiree. Like, there's no like. This isn't Cancun. This is like retirees and
I'm in.
families.
All right,
Yeah, it's
we're
good.
okay. We'll switch over and we'll definitely come. You know, it's funny you mentioned the oxygen stuff. I'm a huge believer in oxygen, but just for the reason that you said with the hyperbaric oxygen, where you can deliver the most oxygen, it is very interesting. We actually use EWOT, exercise while under oxygen therapy. We just do it 3 times a week for 10
Oh, okay,
minutes.
cool.
You do supersets on this thing. So you go 90 minutes or whatever, interval training, very short. It dramatically
Nice.
increases your VO2 max in our athletes. It's like it's amazing, and
Oh,
then
wow.
not only that, the benefits even in so in the past we all know because we have this like very comprehensive concussion program in our on the medical side. Everybody knows that hyperbaric oxygen can help people with concussion. This has been studied before they know it. There was always this thought that you can't exercise people that have concussion, that it's detrimental. There's all kinds of studies coming out now. People have always said, oh, you got to rest, you got to do anything. It's very clear. I was actually going to post one this afternoon about another study that came out that clearly shows that an active recovery program for concussion is best. So
Awesome.
even I was a little worried. I was like, I don't know if I want to put these concussion people on a bike with the pure. They're doing fantastic. Zero. We have not seen.
Oh,
And it helps. It really helps.
cool.
We go slow. We're not like, hey, go full speed when you have your concussed out of your face. I mean, very slow. But we can, but I love it. I love the fact that you mentioned the hyperbaric, because I think that the EWOD is such a better way. You don't get as hyper oxygenated, but you're making your tissues become hypoxic, so they're drinking in the oxygen in a different way, and then you're hitting them with the light therapy and the other stuff, and all together. I mean, people like, even just like with autoimmune disease, they're different. Their energy levels are rocketing. And this is without even the high level stem cell. I'd love to be able to offer all this stuff to them, but they're already better. But certainly, they can use some of this, some of the stuff you guys are doing, because honestly, we can't offer it here. Some of these things. Tell me if there is a story, because a lot of the stuff I'm giving a TED talk here in a couple months, and I started off with a story about one of the people that underwent biohacking that is so impactful to me, that when I think about it, it's like I get emotional about it. It's a concussion patient that he made everybody cry in the whole entire office. give me a story. Give me a stem cell story about like somebody, like some story that's so remarkable that and it doesn't matter. It could be it could be a knee, or it could be like their MS is in remission. Whatever it is, tell me something that like keeps you going, like what fuels you.
And I've got like two in my head that I'm like, they're both.
You can hit them. Yeah, do them both. Do them both. Yeah, we got time.
All right, I'll give you. Okay, I'll make them quick. I can do it. But the first one, this is probably like, geez, I want to say like 6 years ago, and she was just back this year. This lady's probably in her like mid-40s and pretty overweight, right? And she ended up having a heart attack, and she's got like an 8-year-old son at home, and you're just like, come on, like this is horrible. Like, you don't want to see that. Well, after the heart attack, a third of her heart was necrotic. Her ejection fractions, like at like just 29%. I mean, it was bad, right? And stem cells do wonders for the heart. I mean, there's a few, like, it sucks. It's such a big list of things that these help with. It's tough to narrow down. It sounds too good to be true, but the heart treatments consistently blow my mind, because not everything gives you hard data, right? Like, there's a lot of people, oh, my knee feels better. Okay, you can do MRIs, but people don't always like to do follow-up MRIs. I don't have nearly as much data for the orthopedics as I'd like, but for the hearts, they always do. So this lady's 29% ejection fraction, third of her heart's necrotic, and we do the IV, and she could only afford like 100 million IV. Normally, we would have done 300 million. We found that doing at least 1.4 million per pound of body weight is, think of it like a parabolic curve. It starts to flatten out. That's like the peak of the curve before, like, you're not going to get double the results from 600 million versus 300 million. Right. So she does 100 million, and within like 6 months, I mean, her ejection fraction's back up to 55%. So we're like, yeah, nice, right? And she's got this little kid at home she's got to take care of. So I mean, that's why it really hit me so hard. I've got a son. And then she came back a year and 3 months later, and I mean, there was maybe a piece, the tiniest little section that was still necrotic. The whole heart had regenerated. Her ejection fraction was like over 60%. I mean, it healed her heart, and we're consistently seeing that with congestive heart failure or post heart attack people. And if you read the studies up to like 2014, they actually thought the MSCs were becoming myocardial cells, and they found out no, they're just, when you do an IV, it goes straight to the heart, and it starts regenerating, guiding the regeneration, and it rebuilds the heart. So I mean, the success rate for heart treatments has just been through the roof, and there's been so many. But I mean, this lady, I mean, her heart was dying, and it literally brought it back, and that one just blew my mind. So that's one of my favorites right there.
That's a great story. And again, I always have to caution people, it's not medical advice. I haven't looked at that, as a physician, but I hear these stories a lot. And just for people know, I mean, I've had people that have had different types of treatment. Some are stem cells, some are not, for really serious disease, such as, and they've gone down to Mexico. And I don't even know where they went, but some of them have had like unbelievable. And these are people that really are in the know, a lot of medical providers, and they're just like, this isn't working. And again, we have to caution. I mean, talk to your provider, talk to
Oh
people
yeah.
and figure out, what's best for you. But as I tell everybody, you need to be the CEO of your own health, and you have to do the research, because the truth is, even me, myself, as a physician, or people you're talking to, we're somewhat limited sometimes by what we can tell you to do, because we have to worry about it. Yes, on a show like this, I can do it because it's just for educational purposes only. But then it gets into like things that we don't do in the US. Even if it has the most amazing data ever outside of the world, it's just like, oh, might want to look at this website, but I can't give it to them as
No.
kind of a medical. Curious to know, what did her doctors say? Did they chime in? Were they like, oh, this just happened because this is a normal recovery, or were they believers? Did they start sending you more patients, or they do like what we see? We do all this biohacking on people. They have a great result, and their doctor tells them, "Oh, that's just placebo. Oh, you just healed yourself because you wanted it to be like
Medicine must have worked. And then
that." Yeah,
patients will ask, has it ever worked like this for anyone else? They're like, well, no. But the best,
yeah.
another one very similar, this guy from the UK came, literally his arteries were degenerating. They still don't know what it was. They gave him a 3% chance to live, sent him home
Oh,
with a bunch of painkillers because it's all socialized care over there, and they're like, just go home and die. He came to us, same thing, fixed his heart. I was like 5 years ago, and when he went back, his doctors, they asked, what'd you do? This shouldn't have happened. And he's like, well, I went to Mexico and got stem cells, and the doctor literally said, no, we don't talk about witchcraft here.
yes.
It's so consistently get responses like that, and it's rough, but the people know, and that's what matters. And we've got hard data. You can't look at these echocardiograms and not be like, okay, there's something happened there. And this patient, I mean, she's got video on my website, the testimonial, all the documentation, everything. I mean, that's what's cool. It's not just a story. We really have it up there with everything to back it up.
No, that's amazing. It's interesting. I've had patients, and it's interesting because there's a couple docs in town here that use stem cell treatments for they go to these like nursing homes, and they do it for ulcers. Like they do it for decubitus ulcers and other type of diabetic
Mm,
ulcers with good. And I've actually, before I even knew anything about
yeah.
it, the only contact that I had with stem cells is I've referred a couple patients that have like these intractable ulcers and stuff with like the results are incredible. But the funny thing is that those guys are all like, sometimes they're like ostracized. Oh, that's the stem cell guy that goes to the nursing home. I don't even understand why people are opposed to things that have, can you like, they know how excited I get about certain things, but can you explain how good the safety profile is on these things? I mean, it is so
Yeah.
high compared to the drugs that. So people have to understand, in the U.S., for companies, if a company wanted to do and create stem cell products, okay, and basically promote the lineage. So in other words, take it out like without the minimal manipulation, you just you can't you can't do that, but you guys are doing it. So here it's their body's own stem cells. So I tell people it's literally your cells. We're taking them out, you centrifuge them, you're putting them in. So clearly
Yeah.
from an antigen, and you already explained the antigen, but in general, would you say that the treatments you're doing are safe, very safe, or like so safe that it's hard for you to even put it into it to explain it to people how safe it is?
It's so
Yeah.
hard to explain to people. I mean, yeah, even the success rates too, right? Like, I mean, I think if you read the stats, what is it? Like you give ten people an ibuprofen for a headache, and like four get relief. And that's considered one of the best medicines ever created,
Fair, fair, right?
and we're
They
sitting
made a
there.
fortune. Yeah.
Yeah, and I mean we're seeing across the board, like like people just they're healing. Like it's pretty much, if you read through the studies and what we've seen personally, you're gonna have about 5% of people that are non-responders,
Yeah.
and that's just I mean that's unreal for medicine. I mean to have that low of a failure rate. you've got probably about 80% of people get the result they're looking for, and about 15% see improvement, but not 100%. And it varies depending on
Yeah.
what we're treating. That's just kind of across the board. And side effects. So, I mean, the IV, you might get a mild fever the night of
Of course.
because look, you're getting a lot of something new in your system. The immune system flares up because it's thinking it's going to have to attack. Then it realizes there's no HLA. So it backs down. You take a Tylenol, it goes away. And it's happened to me twice in 8 years. And I do 2 to 3 IVs a year. I mean, I don't recommend people do that much, but I've got them. Why wouldn't I? So, and then with joints, you can have some pain like I described earlier. So it might tighten up, but it's geez, I think we've had to give. I've never had an infection. Look, any injection runs a risk of an infection. We've never had an infection. We've never had any like major side effect, major push. Nothing that was like no permanent damage, anything. We've had people maybe for a day or two they're a bit sore. That's the worst case. And then probably the only treatment we have that has any sort of side effect is we do a lot of intrathecal treatments where we go into
Yeah.
the spinal cord fluid. And it's normal to get a migraine from that,
Of
right?
course.
Like
Of
you're
course.
changing that. I got a migraine both times I did it. I've done it twice, but the results are unreal. So it's, that's the worst case is like a migraine. And usually the people that are getting that treatment already get migraines anyway. So
That is
it's
correct.
not too big of a deal for them. So that's about it. No, not a
Yeah.
lot of downside.
No, I think that's great. I mean, same thing with, kind of the injection treatments that are available in the United States. I mean, the downsides are, it's no different than any injection. I mean, people have had, all kinds of things put in their knees before we do I mean, the amount of steroid injections that are done in the United States is like, I don't even know if you can even accurately quantify it, because I can tell you just in the state of Minnesota, the amount of steroid injections that are done every single day it's round the clock. But how much more effective would it be in doing stem cells
Yeah.
instead of that? It's much more effective. There is the cost. The cost is somewhat prohibitive, for people
Yeah.
and things like that. I think those are like really incredible and powerful stories. I'm going to just share something that it's so funny the way that people want to reject some of the things we're doing. So somebody who's become a good friend of mine, his name is Scott Sigman, and he is the founder of Ortho Laser, which is a company that like they actually treat only orthopedic stuff utilizing laser. And he's a franchise here in the States, and he's growing very
Oh,
rapidly.
cool.
He's a well-known orthopedic surgeon, and so we have some overlap because we do a million things. They're very specific and focused, but I've gotten friendly with him. Very interestingly, during the pandemic, he was trying to help, so he had this laser. So he's like, you know what? Let's treat the COVID lung with the laser. I'm not even going to mention the name of the place that the hospital he was at, but he was treating these patients with severe COVID with this class 4 laser. Phenomenal results. People were recovering. He came up with a protocol that was used in other countries utilizing the laser. You know what?
Cool.
You know what? You know what his prize was for it? They kicked his laser out. Like a bunch of doctors got together and said, you can't use that here. You're going way outside of medicine. This is witchcraft. I don't know what you're doing. What are you doing? He's like,
Uh,
I'm shining a light on their lungs. How is that? I don't like. I don't. I don't even know. But we also know that you can improve. It's funny you mentioned the heart thing. If you shine
yeah,
a class 4 laser on the heart when they have low ejection fraction, you can bring it up, right? Because it
I
stimulates the
believe it.
mitochondrial function in the cardiac muscle. So it's like we have all of these tools, but as docs,
Jeez.
I can speak for the docs, we don't want to hear it. We just want to be in our cocoons and say, no, this is how I learned, and this is what I'm going to do. A couple questions, before we wrap things up. Did you guys do? Were you treating COVID patients with stem cells when this whole thing was going on? Was there a protocol for that you guys had?
I mean, there were studies in Wuhan that actually showed it worked, and we did have some that one guy he was in Roatan, Honduras, and got American guy and got it, and then got it was so bad he got airlifted to Miami. His SpO2 was down to like 75%, and they were giving him nothing. I mean, they were to the point they were like, well, maybe we intubate you. And he's like, nope.
Nope.
And
Mm-mm.
he flew to us. He did 100 million IV. And again, I got a video of this. And yeah, we had him back to 99% 3 months later. And, he never needed anything else. We've seen a lot of people with what they call like long COVID with
Yep.
brain fog and things. And so we do IV plus intrathecal there has worked incredibly well, but I haven't really marketed it either because I already have so much trouble with my YouTube channel. I get pulled down like
I was
probably once every year or so. I mean, it's more on the medicine side. They really don't like growth hormone. They hate that. That I had to separate my medicine YouTube channel from the stem cells. And yeah, so I just didn't push anything with the COVID. We treated a lot of people that already knew about us, but I couldn't say anything about it because it was such a keyword to get you shut down. It wasn't worth it.
100%. Yeah. I mean, I mean, now, I mean, things are changing. Obviously,
Yeah.
the thought on COVID and how we were treating it has, I mean, I can't use any other words than radically changed, because I was speaking up on some of the stuff and people were getting pretty upset. I wasn't doing it necessarily publicly, but privately I was. And I know how, we were
Yeah.
treating our family and what I was recommending to people that were just asking me, what would you do? And I said, well, here's what I would do. People were, those same people now are like, I can't believe what we were, they're so upset. I'm like, I told you like in 2021 that this is not the, what we, the direction we should be going. But yeah, it's a big problem, and the ability to get information out there. That's why I think a podcast like this is nice, because generally they let us get the information out, and again, it's for educational purposes only. You're not here saying,
Hmm.
hey, come down tomorrow and flashing, no, I want people to understand what's available and what's out there, and if they're going to go and travel abroad or do something like that, they need to go to reputable clinics. Again, I haven't studied all the clinics, but I am sure that there are
Hmm.
places that are not on the up and up. And obviously, I would not have even thought about having you guys on
Sure.
the podcast without having scrutinized. And I think everything you guys are doing is great, and you're on the right thing, and you're following the laws of your country,
Thanks.
and it's great. Good stuff.
Yeah, and one thing on the COVID that we do that I don't think anyone else in the world does, and this is just our person, like a lot of our patients are the people that kind of think for themselves.
Yeah.
Most of them did not get any of the COVID vaccines or anything like that, but a lot of them are kind of worried about those. So here in Mexico, if you got any COVID vaccines, you were registered with a federal database. And it's crazy. I mean, they give you like this QR code that gives you different info every time they scan it. Like it was it was the most advanced system I've
Wow.
ever seen in Mexico. And we're usually 20 years behind technology wise, like anything government wise. I mean, it's insane, but they did that. And so when we screen our donors, we actually ask, like, hey, did you have any of the COVID vaccines? And then we check via the federal database. And just like, I don't think, truly, I don't think it would be an issue because of the way the vax worked and all of that. But just in case, we screen out anyone that had those. And a lot of our patients really appreciate that because they just, they're worried about what might have been in it and stuff. So just something we do a little extra.
I mean, I can see why, because of some of the genetic changes that can happen based on some of the there was actually a recent article that came out, very reputable scientist, I think it was Yale. I haven't read it yet. It's in my inbox to read, which showed continued replication of the spike, like some of the spike protein stuff way down the road getting worse. There's a lot, and I don't talk about that stuff just because it's very
No.
sensitive. I just know what I do with ourselves and our families. One quick thing. It's interesting. I just want to pick your brain on it because it is something that we're doing. You mentioned you have the ability to do it your way. So you're creating these things. You're giving it. You're doing it with amazing quality controls and very interesting stuff. In the U.S., right? You're absolutely right. What that professor said. He said, you know what? I don't want my own cells. They're defective. I want like a young person. So one of the things that we're offering people, which is again allowed here, and it's totally on the up and up, is stem cell banking. So we have people that come in and they want to do
Yeah.
themselves, and then we don't do it at our clinic, but there are companies. We use a specific company. They're
Yeah.
very good. They've got great quality control. So people bank their stem cells Is that something that you guys do for young patients, or you don't even need to do it because you're using these exogenous cells, so it doesn't, it's like a moot point? But I do think, I tell, like, I have friends now that are coming and they're
Well,
making their stem cells because they want to keep it for a rainy day.
no, it's smart. I mean, look, I did it for my son. We kept the umbilical cord. That I think that's smart to do because if you ever have any sort of leukemias or
Of
anything,
course.
that's what you need, right? But on the stem cell side, the reason I don't do it is because the older the patient is, the slower the cells
Yep.
replicate. So right there's a problem. And the second problem is this is that like I would never want an IV of my own cultured stem cells. If they were just my own, like BMAC or fat, that's fine. Like put back in. But when you replicate the cells, the one problem you have is that the telomere length shortens. So if I went and they did a lipo and we started like cultivating my stem cells, and we thought about doing this for patients when we first got going. I sent my sister-in-law to a training in Mexico City. The patient was 35. We did the lipo. There's this FDA device. It's like got a filter in the middle of this canister with the culturing medium on one side. You put the cells on the other, it filters naturally and they start cultivating. It took like 12 weeks to get 10 million cells from a guy who was 35. So the older you are, the much lower that number goes.
Mm.
So first, the numbers didn't make sense. And the second is as they replicate because the telomere lengths are shortening. Well, if I went and cultured my own cells, like I'm 42, but if most of those cells I'm going to put in myself are going to have the telomere length of like a 70, 80, 90-year old. And when they differentiate, because after about 8 months to a year, they will differentiate. They'll turn into like an osteocyte, an adipocyte, a chondrocyte. There's like 5 or 6 cells they can turn into. Well, if they're from a donor, they're going to have the donor's HLA, and my immune system's going to eliminate them. No big deal. I won't even know what's happening, but they're out of my system. If they were from myself, they're going to have my HLA. So now I've got all these really old cells in me that are going to go senescent sooner. And, I might be setting myself up for like, some problems not too long in the future. And that's part of why I don't want to do that.
Yeah, it's interesting. We did cord blood, for one of my kids, for that reason. And from a stem cell banking standpoint, obviously we're really only offering it to young patients that are 100% healthy for those reasons. I mean, if somebody comes in and they're 60 and they're like,
And you're not culturing, so it's
yeah,
fine.
yeah, and they're just sitting there, and
Yeah, as
maybe
long if you're not culturing, totally fine.
yeah. So it's just interesting. I mean, it's just an interesting thing, but there's more interest in some of those. Again, in the U.S., we are trying to be at the absolute forefront of everything that we can do, because people need to be offered these things, because not everybody's going to be able to say, hey, I'm going to go down to and I'll do all the all the good stuff, even though I'm going to make a trip down there for sure. I think you definitely sold me on coming down. So this has been great. I mean, we could go on for for hours and hours, but I think that you really got the information in a really great, succinct way. I think this has been really helpful, and I think our audience will really start to understand. I think, and we want to pique their curiosity. I want to pique their curiosity on just basically anything that can help them to restore their body, restore tissues. And if they can do it in a more natural way than having all these invasive procedures and these crazy medicines, it's great. So if somebody wanted
Yeah.
to find you, find you guys, what's the best way to find you? What and what are the, just, you can, I'm happy for you, just let them know like all the things that you treat,
Yeah.
and just let's make it easy for the viewers.
So our website is www.dreambody.clinic. If you scroll down on the homepage, like all the treatments are listed, all the links, every treatment page has info, links to studies, price. Like I hate it when you go to a website and you can't get real info, prices, anything like that. Like, look, we're not the clinic that's trying to get people in because of celebrity endorsements, any of that. Like I don't do any of that. we have those kind of people, but like they prefer to stay anonymous anyway, like because we want to keep our prices as low as possible to help as many people as possible. Now, that's always been our goal. So if you compare us to like some of the other main clinics like Panama, Colombia, we're way less. It still costs a lot. It's pretty advanced medicine, but we do our best to keep it down. And, we're on Twitter, we're X at Dream Body Clinic, we're on YouTube. If you search Dream Body Clinic, we've got tons of videos, tons of patient testimonials. So you can see what's going on. And that's the best way to find us. And people can call us too. Like all our consultations are free. People send us MRIs, echocardiograms, all kinds of stuff just to take a look at and even see if they're a good fit, because we don't want to treat someone if they're not a good fit. That's not good for us or them, because bad news travels much faster than good, right? Like, so you don't want a bunch of people all upset they went and tried stem cells and it didn't work. It's not good for anyone. So we do our best to help people we can, and that's why we're so thorough with all our analysis.
No, I think that's great. I can't tell you how much I appreciate the words of you're trying to offer it to as many people as you can. That's literally like my mantra. Like everything we're doing with our biohacking clinics and everything, I know that for some people it's pricey, but they have to understand how much we've come down, because otherwise you could just, right? Like if you look, and believe me, I've looked when we added the stem cell stuff, and brought on Dr. Sager and brought his practice into the clinic. I was looking around at some of the places in the US, Beverly Hills, Miami, whatever. I was looking at some of the prices. I'm like, who and God, no one on this planet is going to afford that stuff. And some of it, to be honest with you, wasn't even at the level of quality that we were offering. So you have to find that. But getting it, I mean, really, these are the treatments that are really going to democratize healthcare. The other, it just doesn't even make sense. We have stuff that we can develop into low cost where a lot of people can get it and really, help people throughout the world. But, we're not doing that. So this has been fantastic. I'm looking forward to coming and visiting you guys. Anything else is there anything that we didn't talk about, like any other, message, that you want to get out to the audience? I think it's been a master class and, in stem cells and just a different bent on what we can talk about up here.
Yeah. Well, we wrote a book. I mean, that's how we got connected, was our publisher, I think, reached to you. But we wrote a book. It's called The Ultimate Guide to Stem Cell Therapy. It's on Amazon. Look, it's not a brainy book. It's a lot of what we went over here. It's very simple to understand. That was the only point of that book. And there's other books like, you held up Dr. Riordan's book there. That's probably, that's probably the best book ever written on it. It's amazing. So there's lots of good info out there, and people need to do their own research, just like you said, like find what's best for you, look, and, go at it. We're not trying to be the biggest clinic in the world. We want to help people, but, we treat 120, 150 people a month, and that's perfect for us. And, there's lots of good options out there.
I think this is great. Like we said, when we started, stem cells are going to be a big part of the future of medicine. One final thing, and I'm going to talk about this, next week. It won't be next week for when this podcast is released, but whatever, it's a week after this is the studies that are going on with utilizing stem cells immediately after a spinal cord injury. And so as a spine surgeon, here is how I think about the future. Here's what I'd like to be able to offer people like a year or two from now. We get a call, so-and-so's getting airlifted in. We get them on the table ASAP. We reconstruct their spine, untether their cord. If they have a total transection, stem cells aren't going to do anything. But if they just have a contusion to their cord and they're not moving anything, imagine so I go in, I put my screws in, then I do a laminectomy right where the cord is. We do the stem cell treatments right on the cord to prevent that secondary injury. And then we put a photobiomodulation probe right on the cord, right there in the laminectomy bed, and close everything. So now they have stem cells and they have light being delivered to that area. You talk about absolutely shutting off that secondary injury, because that's why people remain, not everybody, some people it's just it's really not going to happen, but that's why people continue to get worse and worse, and they never recover their leg functioning. So I couldn't be more. It's so exciting, and the fact that we're not moving fast. I mean, Yale has a study, Mayo has a study. Actually, I got to meet patient number 6, I think, from the Mayo trial that I just met at this meeting. I'm trying to get her on she's very shy, but she had dramatic. So this woman, this poor, I just feel awful. For whatever reason, she wasn't paying attention. And I kid you not, she fell backwards off of like the 3rd-story parking ramp. It was a complete fluke onto her head. And obviously woke up and could, hardly shrug her shoulders. Eventually got into the stem cell thing. So they did stem cells around the cord after they had repaired it. I don't know what the time frame was. I didn't get that much into it. She's had significant recovery. I mean, she's got good biceps and a little bit of, she's got C6. C6, for people that don't know, the difference between a C6 quad and a C4 quad is independent living versus you have to have caregivers for the rest of your life. And that's attributed to some of the stem cell treatments that were done around the spinal cord. Unfortunately, they're only being done at these investigational centers. So if you're not taken there, you're not, you can get it down the road. And I just had another guy on my podcast that hasn't been released yet, but he had some stem cell treatments after the fact. So he got some of his sensation back, none of the fun, but he had it. His stem cells were a year after his injury. It's very different. It's a very different potential outcome because you
got to get it sooner. I get asked a lot about that, and we kind of shy away from it because it's like you need it right away. It's
like down the road, like once it's completely injured, maybe there's a same thing with like we do a lot of this light therapy. Like if you have a traumatic brain injury, the quicker you can get the light shown on the brain, the infrared light, the better you're going to mitigate the secondary effects of the TBI. And so maybe you won't convert to a chronically, concussed patient. And those people, their lives are devastated. They're not the same person anymore.
Oh yeah.
It's
same with stroke.
Yeah, absolutely.
Yeah.
So we do
a lot of stroke, and the studies show it. If it's done within a year, like an intrathecal within a year, or like the stuff you're doing, it's like a 90% success rate. But if you wait longer, it's very like maybe, it's a flip of a coin. Otherwise it's tough.
The earlier I had Dr. Hamlin, he's like the OG of light therapy, most famous researcher in the world. And he just said he just says like these things. He's like, I think that the earlier you get the light on the brain is better. Like he'll just say stuff like that. And I was like, absolutely. That's exactly right. Same thing with like stem cell treatments and whatever, but there's so much more it's funny. Yeah. They did these 3 large studies on stroke where they did light on their head. The dumb thing was, so what they basically were able to say is it's very safe. You can do it all day on stroke. You put all kinds of light on. What they didn't do though, is they did one treatment. Come on. This is your big stuff. And it's because people don't have money. They did one. Like, what is that going to do? No, you should have done it every single day, every single day. Because even residual stuff, we're doing it off-label, again, not medical advice.
Yeah.
People are having significant benefit, certainly more so in TBI concussion than in some of these stroke patients. And we just tell the stroke, listen, your stroke was, I don't know. This is very safe, but we don't know if it can do anything. The other day I got private I did a post on light in the brain, and I had so many private messages from all these people. And I said, this is not, maybe you can try it. All we know is it's really safe. We can tell you it's not going to hurt you.
Yeah.
I can tell you that.
Yeah. Right.
And it's low cost. So anyway, this has been great. We definitely should do this again. I look forward to, I'll thank our publisher, or my future publisher, because I'm not published yet. It's coming in 6 weeks.
Okay.
I don't know if you have a podcast, but if you had one, I'd love to come on and talk about my book, which I hope it's a 7-hour podcast, by the way, because once I start talking about that stuff, I won't be able to control myself.
Well, we'll get you down here one of these days, and we'll just do a whole video while we're
Well,
while we're getting some IVs.
well, certainly. Well, yeah. What I would tell you is, if I come down there, what I would do is I would bring up one of my like film people, and we would just do an entire show from there, because I am going to start doing that. I'm going to do an episode
Oh,
soon
good.
with an acupuncturist, very well known, that takes care of a lot of the pro players up here in town. And I'm just going to go
Nice.
to a clinic, get some acupuncture, get it all on, do a podcast, do the whole thing. I'm going to.
Nice.
People love that stuff. I mean, they just
Yeah.
eat it alive.
Well, it's
Uh,
fun to do.
it's
I've found
great.
if like you like doing it, people probably are gonna like to watch it. So
No, I
that's what
love.
I try to do.
In fact, it was about 10 years ago. I always wanted to get into into kind of this media world. I
Yeah.
actually pitched to a fairly big company a show I wanted to be the host of. I wrote all these scripts. I did all this stuff. I get pretty dialed into these things, but it was called A
Nice.
Taste of Your Own Medicine. And the way it worked was, we were going to show up impromptu to doctors' offices and make them undergo the tests that they dish out every day, that they've never had before. So their whole staff would be notified, everybody would sign waivers, all that stuff. But the only person that wouldn't
Yeah.
know was the doctor. So sometimes,
I
obviously,
like
we're going to
that.
be rejected, right? But I don't,
Yeah.
but doing, like, for example, a cardiologist, they do like these stress echoes. It feels terrible to have to get that stuff injected, because you feel like you're having a heart attack. So,
Hmm.
before we go out dishing all these procedures, maybe we should kind of know what it's like to have
Yeah.
it. And I think that will make our empathy levels, go up and stuff like that. So it'll be a good one. So I'll do a taste of our own medicine. I'll get some stem cells with you, show people that I'm fine and I'm happy and I'm thriving and all that stuff when I'm down in and I'm at the beach and getting a tan and all that stuff. So
Yeah.
anyway, this has been wonderful. Thanks for joining us today. Thanks, everybody, for joining us on another episode of Wellness at the Speed of Light. Hopefully you enjoyed this. This is one of my favorite episodes. This has been great. Really enjoyed this discussion on one of the things that's going to be the future of medicine. Hopefully you learned a lot from this. We'll see you on the next episode, guys.